Okay, good morning, everybody. My name is Ariel Majidi.
I'm Steffi Castillo.
And I'm Bob Patel.
I'm Darlene Nanyalugo.
And with our grad students who couldn't be here today, Serena Brown and Shreya Kant, we are Women's Health Santiago, a project that aims to assess women's health needs and resources in the predominantly Mayan indigenous community of Santiago Atitlan in the Guatemalan highlands. Our project is born out of the UVA Guatemala Initiative, which is an initiative that was founded by Dr. David Burt in the Emergency Medical Department, and it aims to connect UVA students and faculty members to Guatemalan NGOs. And one of these NGOs, our community partner, Hospitalito Atitlan, is a non-for-profit hospital that serves the community of Santiago Atitlan, which is a very socially and economically and culturally diverse community. Hospitalito Atitlan in October of 2010 came to the UVA GI, came to us and called on us for a need. They wanted to learn more about the women's health perceptions in the community that they were serving. So rather than posing us with a problem, we came in from an approach of learning, not a problem-solving attitude. We wanted to create a survey that really questioned the perceptions community leaders, healthcare service providers, men and women, had about women's health. How we went about doing that was designing a broad-based 25-question assessment with the help of Hospitalito Atitlan. And so we questioned factors of social and physical implications of women's health. Naturally, one of your first questions relating to social health would be, does this community experience domestic violence? Well, we learned that we couldn't ask that question directly. Domestic violence isn't a recognized term in Santiago Atitlan, and even the word violence, la violencia, refers to the civil war in Guatemala. So we learned that creating the survey wasn't as straightforward as we thought it was going to be. We really had to partake in an extensive preparatory process to learn about the complexities of Guatemala. So how we went about doing that was in the spring of 2011, we all started taking online language courses and met weekly to learn about Guatemalan history and culture, reading books, discussing articles. When we came to Guatemala in June and July of 2011, we spent 3 weeks at least in a Spanish school and staying with a Guatemalan host family, just learning about the Guatemalan way of life before we even started our project, our survey.
Okay, so once we were in Santiago, we split up in pairs and did informal interviews and used convenience sampling as our methodology. And we also had an interpreter because the majority of Santiago speaks Tutuhil and Spanish is their second language. And so what would normally happen is she would translate for us and then we would transcribe in Spanish. This next slide shows our interview distribution. So we were in 4 different places, and we interviewed four different constituencies within that population. And in the end, we did 200 interviews within the 3-week period. So we used a coding system as our method of data analysis, and the coding system was basically based on basic content analysis, which is a quasi-statistical approach that looks for similar themes, concepts, and words in responses and then uses a code. So for instance, if someone had said, like, I don't have money to go to the doctor, or there isn't enough medical supplies, we might use LF to stand for that might stand for lack of finances, and so that was the way we categorize information. And so after our survey assessment and the coding analysis was done, we redirected our survey questions into more broader, big picture questions that would guide our analysis.
Our first big picture question had to do with accessibility and what resources in the community that individuals knew about. So we asked, when you're sick, where do you go? And many people said that they go to the doctor or to the clinic when they're ill. But a significant number also said that they self-medicate, meaning that they use over-the-counter medication or remedios caseros, home remedies. And although there are 3 clinics in Santiago at Titlan, the majority of people do utilize the traditional providers such as midwives and use these home remedies. One physician that we spoke to at the Centro de Salud, the government health clinic, talked about how a lack of financial resources can inhibit people from seeking the preventative care that they need. And it relates to the experiences that we have here in Charlottesville. So it's not just unique to Guatemala, this idea of lack of preventative care and finances. One of the reasons why our community partner, Hospitalito Atitlan, wanted to partner on this survey was they desired to know about perceptions in the community, about their organization, why many of the indigenous women would only come to their clinic when they were already in labor and experiencing complications during the labor. So it's very important to recognize that there's many factors that contribute to whether women come in for preventative care. Our second big picture question had to do with whether people were content with these services for women. So we asked whether women have the necessary resources to leave in situations of domestic violence. And about 40 to 45% of men and women said no, that women don't have the necessary resources, that many women will keep quiet when they're feeling sad or they're experiencing physical, verbal, emotional, or sexual violence. And it's critical that domestic violence be addressed. Our third big picture question had to do with obstacles to healthcare. So along with the lack of financial resources that we mentioned, some other obstacles were transportation, culture, fear and shame, a lack of medical supplies and medicine at the clinics, and language barriers. So language barriers was a surprise to our community partner because they do provide Spanish Sutuil interpreters. They didn't realize, though, that because they have a lot of doctors that come from foreign countries and many of their Guatemalan doctors come from the larger cities in the country, there was also the cultural divide, and it was necessary to address that as well. Our final big picture question had to deal with education. And when we asked whether men and women have the same educational opportunities, the majority of people did say yes, that they have the same opportunities, but still a significant number said that there are differences in their opportunities as a lack of financial resources in the home and pressures from the family for women to enter the domestic sphere will preclude women from attending school. And education can affect health in many ways. So, for instance, one woman mentioned that because women, some of them can't read or write, they don't go to the authorities and file una demanda or a report about domestic violence, or that some women fear going to the clinic because of their inability to read the information that they're given. So when you're trying to address the issue of improving women's health, it's necessary to look at the physical health, but then also the other aspects that can affect it, like emotional health and education.
So as with all projects, ours wasn't completely void of limitations. One of them include language barrier. There was many people in the community who spoke very indigenous small languages that even our translator couldn't understand. And then as well as the previous graph that you saw, which we didn't really have a very even distribution of population per group and location. And so we would have liked to do that. And our time and country was limited as well. Some other biases include not being able to talk to all the directors of organizations in the community as we would have liked to. And this just shows that these directors are doing a lot of work, and so we don't have that much time to speak with them. And finally, we distributed a comprehensive report back to the community so they can improve on what we found. And more surveys have been completed by Guatemalan students who are now beginning to analyze the results and to compare it with our current findings. And unfortunately, due to travel restrictions, no students will be able to go back and continue with this project, but our UVA faculty and partners in the community have showed us a commitment to develop our project further and use it for future research. And finally, thank you to all our mentors, and especially to Center for Global Health and Jefferson Public Citizen for supporting us.